You just start with the lowest effective dose and build your way up over the course of 15 years. And by the time you're 40, you have developed a very impressive physique on dosages people would laugh about and call you a liar for. But at least your blood work will look good. Vigorous Steve here. I'm going to give you guys some guidelines. Guidelines to live by so you don't have to end up dying for this bodybuilding shit. Some guidelines to put into place which are going to severely limit your aspirations. But at least when you get a little bit older and you're ready to close off this book of bodybuilding, right? For most of us, bodybuilding is just going to be a phase. And whether you stop at the age of 40, 50, 60, 70 years old, at one point, you're going to have to stop bodybuilding. You'll become less physically active because your body is slowly deteriorating. And then when you get to that point in your life, you are not going to be filled with regret, wishing you didn't do all those things to your body in your younger years for the sake of gaining a little bit of muscle. So at least the quality of life when you're a little bit older is not going to be hindered or impacted or severely limited with the things you did right when you were 20 or 30 years old. And these are going to be guidelines that I wish I had when I started my performance-enhancing drug journey, and I'm sure they would have been beneficial to me when I started bodybuilding at the age of 15. But unfortunately for me, I had to figure it all out the hard way. So this is going to be my transfer of knowledge, things I wish I knew when I started bodybuilding. And I think I've done several of these videos already, right? Medical screening that I wish I did before I started taking performance-enhancing drugs. So I will list the appropriate video when I don't want to repeat myself over and over and over again. So I'll link them up here for your viewing discretion. This video is just going to be an overview of things you need to put into practice and restrictions and guidelines so you can have a full life right now and 20, 30, 50 years from now. Before we get into it, please like the video, leave a comment for the algorithm, and consider subscribing if you haven't already. Let's get the basics, the foundation out of the way first. Learn how to train hard. You still need to send that signal for hypertrophy, and without training hard, you can take all the performance-enhancing drugs that you want, but they're only going to take you so far. Yes, I'm very well aware that performance-enhancing drugs, especially anabolic androgenic steroids, have been designed to prevent sarcopenia, which is muscle wasting in the case of being immobilized, for example, after a spinal surgery or whatever else, right? In cases of severe burn victims, right? These steroids have been prescribed to put muscle on you, but they're only going to put so much muscle on you if you're not training intensely. Watch some of my YouTube videos where I'm training. Watch some of my Instagram posts where I'm training. If that looks foreign to you, you need to level up. You need to increase your workout intensity. You need to level up before you're considering performance-enhancing drugs. Bring your A game to the gym every single time. If that means you're going to grunt and people are going to get annoyed, so be it. You're there to put in the work so you can recover post-workout and grow a little bit of muscle tissue as a result of that. You're there to build some character, to grind through those strenuous sets where your body just wants to give out, but your mental fortitude is preventing that from happening. And as you get stronger and stronger, so will your muscle mass follow until you inevitably reach your natural potential. Now, a lot of people think they reach their natural potential when in reality they haven't reached it at all. There's a million different things you can optimize before you consider performance-enhancing drugs. One of them being your digestion. Made a video about it. You can watch it here. Follow that to the T. Figure out which foods work for you. And it's a continuous process because as you age, and especially when you start adding in the performance-enhancing drugs, your digestion might change. Keep that in mind, right? Nutrition is always changing, always dynamic. You stick with the foods that work for that period of time, and when they no longer work for you, they give you indigestion or you build up a little bit of a food insensitivity, so to say. You take those foods out. If you're not really sure what's going on, keep a diary of your lifts and your nutrition and the health supplementation, etc., etc., etc. So you can scroll back a couple of weeks and see, okay, I added in particular food to XYZ, and now 8 weeks later, my digestion is kind of ruined. Maybe I need to take that food out. That was the only change I made a couple of weeks ago. Right? Keep track of everything that you're doing before you start adding in the performance-enhancing drugs, because that certainly complicates the matter way more than natural bodybuilding. And I want to throw in some low-hanging fruit, things you need to put into practice, but everybody seems to neglect nowadays. Do some freaking fasted cardio, man. Just put it in there. 30 minutes, fasted cardio every day, as many times during the week as you can, right? If you have to skip a day because you're busy or it's leg day, okay, I understand that's 5 days of fasted cardio that you have every week. Not for fat loss. I don't want to hear about, oh, you can do cardio any day, time of the day. I can do it post-workout, before bed, in the middle of the night, I don't know, walking in between sets or whatever else. Still do 30 minutes of fasted cardio to get the day started. You do something positive for your heart health. The fat loss is just an added benefit. And look at it as increasing your insulin sensitivity and the nutrient partitioning for a couple hours afterwards. It's a huge benefit as well. But the fat loss that you get from it, or the prevention of fat gain during the off season, that's just a huge bonus. You do the fasted cardio for heart health. And while we're on the subject of heart health, look into a couple ancillaries, the ezetimibe, the nebivolol, the telmisartan. That's a good starting point. And if those don't work, okay, you look into a PKS9 inhibitor or another beta blocker like a propranolol, for example, which is not very selective. It just blocks all of the beta receptors. And if telmisartan is not working, there are many other angiotensin receptor blockers or angiotensin converting enzyme inhibitors to choose from. You go with the one that controls your blood pressure the best. And if that's telmisartan, you get good response from telmisartan, right? There's some additional benefits which are unique to telmisartan. That's why I usually recommend telmisartan first. Do some fasting. You're not going to lose muscle. And again, if you're restricted by a certain weight to prevent sleep apnea or prevent all this strain in your heart at a higher body weight at more advanced stages of bodybuilding, which you shouldn't be doing anyway, do some fasting, dude, for a couple days every 3 months. Seems to work well for myself. Many of my clients do this. Not only does it build up perseverance, but it allows you to detox, right? You schedule that with a deload. You're not going to the gym. You're just sitting on your butt at home playing video games or doing whatever you've been neglecting and procrastinating about for the last couple of weeks while you were going to the gym and making ends meet because you're working all the time. Now you have a week of rest from the gym, frees up your schedule. You have a week of rest or a couple days of rest from eating, frees up your schedule tremendously, especially if you're cooking multiple meals fresh per day. And now you have all this extra time to take care of business, things you have been procrastinating about. And as the days progress, you might lose a little bit of cognition because, well, I know the fasting is hard. It's not for everybody, but the amount of detoxification which will occur with a proper fasting protocol, unmatched. You can't get it anywhere else. Plus, you will restore insulin sensitivity at the end of an off-season when you've been eating in a caloric surplus for a while. And you lose a little bit of fat in the process. Who doesn't want that? Right? And even though it's tough, the fat loss alone is highly beneficial. And the detoxification and improving of your blood work markers and everything else, highly beneficial. Just put it in a couple days every 3 months. If you can last 5.5 days, right? Fucking big up on you. It's very tough. I've done it every 3 months myself. It's not something that is easy, but you'll feel also good. You feel also clean and also mental fortitude after a 5.5 day fast, especially when you get your before and after blood work results. You're like, wow, can't believe how fast it improved. And then you have had a couple more months left in you on the cycle, which hopefully you're restricting your dosages to not too much superphysiological levels, considering all the medical screening that needs to be in place when you start taking endocrinology in your own hand and simultaneously play your own nurse, endocrinologist, hepatologist, hematologist, cardiologist, and everything else. You're not just going on steroids. You need to have fundamental understanding of the medical field before you even considering to dabble with testosterone as a base. Now, that's the nutrition and the training. You need to have your health supplementation in place, and for that, you need to do your blood work. See what's going on internally. See which genetic limitations you have. Perhaps you do a 23andMe genetic analysis to see what's going on internally, right? You do all the examinations that I wish I did when I started my performance enhancing drug journey. You can watch that here. Do all of that. set some money aside while you're undergoing this road towards your natural potential with training, health supplementation, and nutrition. Put some money aside for all the necessary health screening that you need to do before you start dabbling with PEDs, because then at least when you start, you have a fundamental grasp of where you are right now and what you need to pay attention to when you start adding in the PEDs. Now, when you're on performance-enhancing drugs, you open up a can of worms, right? Pandora's box, because there's a million PEDs to choose from, and they all seem so very, very, very exciting. A couple guidelines for you to pay attention to and to limit your aspirations with. Stick with pharmaceutical-grade compounds. There's not many, and the list is getting shorter and shorter and shorter for a multitude of reasons, right? Or whether that's the FDA restricting particular compounds, or certain drugs are no longer efficacious, or there's a better alternative on the market, right? Drugs get replaced all the time with first generation, second generation, third generation of whatever medication is being brought to the forefront in the market after several years of clinical research. Right? Medications and scientific evidence is ever evolving. So you need to stay up to date. And the best way to stay up to date is by signing up to uptodate.com. Now, unfortunately, that's only available for medical professionals. But if you work on your network and maybe get a girlfriend or a boyfriend that's studying to be a nurse or do something in the medical field, right, you can find your way into uptodate.com through that avenue. Restrict yourself to pharmaceutical grade products. I'm very sorry, underground labs, you're always running a risk. If you have no other choice, that's the way it is. But honestly, I would rather brew my own stuff and run the risk of importation than to use somebody else's homebrew, because then at least I get to control the variables. Now, luckily for me, I can get all the pharmaceuticals I need here in Thailand over the counter or under the counter. So I have at my disposal testosterone enanthate from Rotex Medica or Bayer Rimabolan being primobolan methanol enanthate. I have Anavor pharmaceutical grade, albeit for export. I have Decadurabolan from Organon, which I don't want to touch because it's in Arachis oil, and I don't want to touch the pharmaceutical grade testosterone propionate or cypionate because it's in ethyl oleate, and both of those carrier oils give me systemic inflammation. Man, so much to think about, right? Not only should you restrict yourself to pharmaceutical grade compounds, right? FDA approved compounds that are available on prescription in any part of the world, but even when it's on prescription and it is available as a pharmaceutical, doesn't mean it's right of the utmost highest quality, because Arachis oil and ethyl oleate seem to give some people issues as well, right? Systemic inflammation. Talked about this many times before. Watch one of these videos. Read the article on my website talking about synthetic carrier oils and how you can mitigate some of the side effects from that. Get informed so you can make the proper choices on what you're injecting into your body, because the systemic inflammation might just give you a little bit of a test flu-like symptom in the beginning. But over years or decades, right, if you're exposing yourself to performance-enhancing drugs for that long, right, your bodybuilding journey is lasting well into your 50s, which I can't really advise. If you're on PEDs for that long, right, the cumulative effect of systemic inflammation, that's for sure coronary artery disease. For sure. For sure. It's a given. So I might as well just avoid it and not even do one injection. So that's the pharmaceutical grade compounds. And if you can't afford pharmaceutical, or pharmaceutical is somehow not available, you don't want to run the risk of illegally importing pharmaceuticals from another part of the world. Again, I completely understand. The legal system is not very for bodybuilding, so to say, especially not advanced bodybuilding. Then you go in an underground lab. Consider home brewing by yourself so you can control all of the variables. And again, there's a huge learning curve involved with home brewing, but at least that way you're in control of what you're putting into your body. You can choose to go with castor oil and a low amount of benzobenzoate, or cottonseed oil, or grapeseed oil, or even sesame oil, right? None of those cause systemic inflammation. There's a huge learning curve, but in the long run, right, you're better off for doing it by yourself. Now you have this knowledge. You can avoid the Arachis oil, you can avoid the ethyl oleate, or whatever else the underground labs use nowadays. Just avoid it. Please, just avoid it. Because all these heart attacks are common due to coronary artery disease, right? A little bit of plaque buildup. And then we have a whole situation whether that's the vaccine or the virus itself, causing clots. You induced coronary artery disease, and we have a global situation where blood clots are getting more common and more common and more common. And now we have a little bit of a tricky situation because there's things that are potentially deadly, whether that's immediate from getting sick or a clot that forms afterwards or after taking a vaccine. And then a situation where you're inducing your own cardiovascular disease because you're not careful enough of what you're putting into your body. And then you combine that with the overlapping issues of micronutrient deficiency, which are oh so common in bodybuilding. Again, if you follow the guidelines, you already had your nutrition and health supplementation in place before you started dabbling with PEDs. I did. At least I did when I started taking performance-enhancing drugs. I had all my micronutrients covered. The vitamin K, the vitamin E, the fish oil. And if you want to take it to the next step, consider a baby aspirin. Personally, I don't want to take it because of the stomach-related issues that might manifest with prolonged exposure to aspirin. So I'm on top of my vitamin K, my vitamin E, my fish oil, my curcumin, anything that has to do with optimizing or preventing coagulation, right? So you don't get into a state of abnormal coagulation or blood clots being exacerbated by the current situation that we're in, being further exacerbated by taking performance-enhancing drugs that cause systemic inflammation. At one point when you're forced to take the vaccine, there's no other choice because, again, you have to take it for healthcare, or you have to take it for international travel, or for your visa, or for your job, or whatever other excuse they're going to enforce on you to take the vaccine. Make sure you have some money aside for an MRI or a CT scan, so at least you know that your calcium score is 0. And if your calcium score is not 0, maybe you can use this medical certificate to get your way out of this vaccine. And again, guys, it's just some food for thought so you can be 10 steps ahead of the situation and make much better decisions, much more informed decisions, right? So you don't end up dying over this shit. Let's talk about the dosages involved and give you guys some guidelines, more of a restriction regarding which dosages for which compounds could be considered safe, because they have been studied. But again, they have been studied for short periods of times, maybe a couple of weeks to months, certainly not years to decades, right? And we're exposing ourselves to these performance-enhancing drugs perhaps for decades in duration. And well, that hasn't been examined, and certainly not in a combination that we do for bodybuilding purposes. Testosterone has been examined in young men up until 600 milligrams per week. It seems to be generally well tolerated. Anadrol has been examined in elderly men up until 700 milligrams per week. And primobolan has been examined up until 1200 milligrams per week in women with advanced stages of breast cancer. Now, these studies are very old, right? The testosterone studies in men are from the early 2000s. And this methylene enanthate study in women with advanced stages of breast cancer was performed in 1968. So that was over 50 years ago. I'll link all of these studies down below so you can give them a read for yourself. Basically, the general consensus of these 3 studies is as following. More is not better. More is not better. Again, you have to optimize everything if you want to bodybuild. Not just look at the dosages and consider that to be the gold standard of your bodybuilding journey, right? I need to go on 600 tests, 700 anadrol, and 1200 milligrams primobolan per week. Again, these have all been performed separately, these studies, separate studies with these particular dosages, not in combination, guys, not in combination. So the highest study dose of the exposure of androgens has been 1200 milligrams in women. Apparently seems to be well tolerated. But when you read the medical insert of primobolan, right, coming from Turkey, I got that sweet insert right here. If anybody wants to translate this for me, hit me up on Instagram. I'll reply as soon as possible. I want this translated by somebody who speaks Turkish and English. And then I want to go over all of the details because at one point in the future, I'll release a video about all the clinical dosages, whether that's anavar, primobolan, nandrolone, testosterone. I just want to release a separate video regarding that, about the clinical dosages which are still being used up until this point. And well, I can't read this medical insert because it's in Turkish, but I was able to translate part of this insert into English using Well, Google Translate. So let's go over that right now. So this is only a very small part of the inserts regarding administration protocols that I translated for this video. Instructions for proper use and dose or frequency of administration of Bayer Rimabolin. 1 ampule every 2 weeks in adults. After a good response, it is applied every 3 to 4 weeks. So that's 100 milligrams every 2 weeks in the beginning. If everything goes well, that's 100 milligrams of Bayer Rimabolin, albeit that they're overfilled, so you're probably getting 125 milligrams Rimabolin out of it every 3 to 4 weeks. In very thin and structurally underweight women, the dose is half an ampule, 50 milligrams, applied every 2 to 3 weeks and should not be exceeded. 2 ampules of Bayer Rimabolin at the start of the cycle, then 1 ampule of Rimabolin should be used once a week. I'm not exactly sure which medical condition this is for, right? Some of the administration protocols vary when I'm translating these inserts. But again, so it could be 2 ampules Rimabolin as a Rimabolin kickstart, and then switch to 1 ampule Rimabolin used once per week. In continuation of treatment, the injection intervals can be increased to every 2 to 3 weeks. So as the duration of the treatment increases, so does the injection interval. So in the beginning, the dose is higher compared to later on during the treatment, where the dose is generally tapered off. For advanced breast and genitalia region cancer in women, 1 ampule every 1 to 2 weeks or 2 ampules every 2 to 3 weeks of continuous treatment. So this is just a small translation. And basically, the dosages vary between 1 ampule of Bayer Rimabolin per week or half an ampule or even less. So that's for the medical treatment. And again, it has been examined up until dosages of 1200 milligrams Rimabolin. But in medical settings where people are treated with Rimabolin or Primobolin, methanol enanthate, the dosages are very, very low. The dosages are very, very low for the treatment of particular medical conditions. It's the same for Anavar. It's 10 milligrams, 20 milligrams at maximum, spaced out over 2 or 3 administrations over the day, right? While people are undergoing a particular medical treatment where Anavar is being prescribed. Testosterone replacement therapy, 100 milligrams per week, 125, 150. Generous TRT clinics might bump that up to 300 milligrams. But if you go into the medical inserts of testosterone, the dosages are far, far less than some of these very progressive TRT clinics are willing to prescribe. And the clinical dose for Parabolin, Trenbolone hexahydrobenzyl carbonate, was 76 milligrams administered every 10 to 14 days? That's 50 milligrams of actual Trenbolone for every 10 to 14 days. Which bodybuilder gets out of bed for that dose? Not many. I know right nowadays people run Trenbolone, 50 milligrams Trenbolone acetate per week during the off season or even in contest prep, where all the other steroids are megadosed, basically, to preserve the muscle tissue, and the Trenbolone acetate is just cherry on top. But most bodybuilders would not get out of bed for the clinical dosages, even though I would say that I would get out of bed for 5 milligrams of oxandrolone per day. I've run that multitude of times. Doesn't change my blood work parameters that much, but I get a good response and a good mind-muscle connection, a little bit of a better pump, and certainly additional muscle tissue out of that. That's 35 milligrams of Anavar per week. Far less than the clinical dose, but again, that's on top of a testosterone base. So if you go by the clinical dosages and what is generally recommended in particular clinical settings, and we restrict ourselves to pharmaceutical-grade compounds, there will be a testosterone base of, 150 milligrams testosterone enanthate or cypionate per week, 1 ampule of Bayer Rimabolin per week. Again, I can get more than 100 milligrams out of that, so let's say 125 milligrams methanol enanthate per week, and 5 milligrams Anavar per day. Sounds very close to what I was running previously, ending up looking like this. Now, would I be able to build that physique on these dosages alone? No, absolutely not. I'm well aware of that. I was solely relying on muscle memory. I used way higher dosages and way more complicated drug combinations in the past, right? I'm solely relying on muscle memory in that picture, but at least while running these compounds, while excluding the Anavar, which I was not running at the time, my blood work looked pretty damn good. My physique was good and my blood work was good. So even though I accumulated all this muscle tissue at higher dosages, I was able to retain and look cosmetically pleasing with a fraction of that dose. right? And having very representative blood work of the physique that I had in this picture. Now, I've increased the dose to 600 milligrams since that time, and I'm pretty comfortable here. So even though testosterone has been examined up until 600 milligrams and primobolan has been examined up until 1200 milligrams, a combination of both up until 600 milligrams gives me the physique that I want. Could I have built this physique on 600 milligrams? Probably yes, if everything was optimized along the way, which to me came as a progression over time, right? Because, well, the information was not there and I had to figure it out the hard way. So if you want some restrictions and guidelines regarding the dosages on what should be considered safe for the short term and long term, look into what is generally prescribed and look into the studies where higher dosages, supraphysiological dosages which are never used in clinical settings unless it's for a particular study, look into those dosages and make a decision for yourself if that's going to be worth it for you in the short term and the long term. I've ran 1,000 milligrams of primobolan. Was it worth it at the time? Yes. Would it be worth it now? No. No, because I've developed my physique and I need a fraction of this dose to sustain it. It will still be a progression to get towards your physique where you feel happy, but there's a handicap and a restriction there as well. Most people will start to notice sleep apnea, which will severely detract from your health and in the short term and the long term. Right? Sleep apnea causes a multitude of issues. Now, I know what you're going to say. Yes, I'm just going to get the APAP or the CPAP machine. But instead of forcing it with using a breathing apparatus to keep you alive, basically, during the night, right? Prevent you from choking out, so to say. So when you've reached that point where you need a CPAP, instead of going for a CPAP, take a step back and observe the situation. Your body is literally begging you to lose some weight. Right? Otherwise, it will be functioning correctly. Just take a step back. Right? Record that video overnight and see how bad your sleep apnea actually is. Made a video about it already. Give it another watch. Right? Make sure that you like and comment for the algorithm, right? So we can push it to people who are still not aware that they're doing all these crazy things to their body for the sake of a little bit of muscle, which eventually is going to go away anyway. When you get into a state of needing a CPAP machine, it's time to take a step back because it's no way to live with a CPAP machine. It's literally your body telling you, okay, this is the maximum weight I can tolerate. And if you need to proceed somehow, or you're literally going to need a breathing apparatus to prevent you from getting into a terrible health condition and high hematocrit levels and poor libido, et cetera, right? Poor cognition during the day because you're not really sleeping while you're in bed. Now, if you need to use a CPAP machine due to a legitimate medical reason because you have central sleep apnea, for example, or the signal from the brain to breathe correctly while you're sleeping is somehow not optimal, then you obviously need a CPAP machine, but that would probably already have been diagnosed in your younger years, way before you got up until a point where you were super, super heavy due to your bodybuilding aspirations, right? You need a CPAP machine because there's an issue with the signaling. You don't need a CPAP machine because you got too heavy, or there's an issue with your breathing tubes forcing you to be on a CPAP machine while you're sleeping as well. And we can actually use some of the guidelines set by the IFBB Pro League regarding the weight classes of classic physique. I've yet to this day meet a classic physique competitor that got sleep apnea. And are the classic physique competitors dying from heart attacks? Not really, right? It seems to be only the bodybuilders that are dying from heart attacks or get into severe health complications and really need to slim down just to be able to continue to live. Classic physique, albeit that it's a much newer class, it seems that the drug abuse is not that rampant, albeit that I'm sure that the amateur league and particular competitors are abusing the drugs just to have that physique that they need to be competitive. We can use this as a guideline to set some restrictions on our weight. Because again, up until now, I haven't met a classic physique competitor that suffers from sleep apnea, unless it's from central sleep apnea, which has nothing to do with their bodybuilding aspirations or their classic physique aspirations. That's simply a defect that they had to deal with their entire lives already. For example, right, I'm 175 centimeters, so that's up to 5'9". My weight, if I were to compete at Classic Physique, is up to 200 pounds, 91 kilograms. Now, this is when you're in phenomenal shape and perhaps a little bit dehydrated to make weight. So we can add 10% to that, add a little bit of a fat, and add a little bit of water back. That should still be considered safe and more healthy than making weight for Classic Physique at this height. So I could be 100 kilos, 102 kilos, right? But most competitive athletes would stay about 10% or 15% away from their competition weight, right? During the off season. So add 10%, add 15% of their competition weight. So let's put it safely, right? 10% extra, adding a little bit of space for glycogen retention, water retention, and put a little bit of fat back so you actually feel good. 10% increase from 91 to 102 kilos. Guess where I am now? 102 kilos. That's where I feel comfortable. I don't have sleep apnea. I don't snore. I don't feel lethargic. I can do 30 minutes of fast cardio every day and get my heart rate up to 135 beats per minute and blast through that cardio session on the elliptical 30 minutes every morning, every day of the week for the last couple of years. And guess what? Yours truly has no heart enlargement proven with an MRI with contrast. So maybe there's something to say with that. Of course, I'm running 5 milligrams of Nebivolol. I'm running 400 milligrams of ubiquinol per day and 5,000 milligrams of taurine. That all helps with cardiovascular and heart health as well. All these things you need to have in place when you're taking performance-enhancing drugs. So again, we can use the guidelines set by the IFBB Pro League regarding Classic Physique at 10%, maybe 15%. That should be your maximum weight, a weight where you should still stay somewhat aesthetic, somewhat presentable, should not get sleep apnea, and that's going to be the overall determining factor whether you're too heavy or not. I want you to take these guidelines to heart, guys. Take it to heart, please. There's only a short window of opportunity where you can actually build muscle and do a couple cycles, right? You only get so many cycles. You can only expose yourself to so many milligrams of androgens, right? Just like you have only so many heartbeats. Or if you're a woman, you only have so many eggs to ovulate. There's only so many milligrams of anabolics you can expose yourself to before your health starts to decline. And I feel for myself that I'm getting quite close to this point. That's why I feel I have about 2 cycles left in me. And well, by the age of 40, the physique doesn't really want to do it anymore, from what I've seen. And most guys start to get issues after the age of 40. Now, I'm sure there's an overlapping effect of what you do from the age of 25 to 40, which from everything that I see in the fitness industry seems to be the sweet spot where you can develop your physique, get away with moderate dosages, reasonably unscathed at later stages of life, and still have a good response to what you're trying to do in bodybuilding regarding the drugs and the food and the training. And then, well, somehow at the age of 40, the body starts to deteriorate a little bit. And whether that's your body no longer wants to respond to the strenuous training or the food quantities required or the health supplementation or your blood work simply starts to get worse and worse and worse and worse as you get older or you're not responding to the drugs. I think there's a window of opportunity for all of us from the age of 25 to 40, which, well, is only 2 years away from me, unfortunately, where you can develop your physique, bank on it, right? Make money from the sport because you look phenomenal. And well, nowadays we have social media to really bank on it and be, right? You have control over your own destiny and how much money you make, which I didn't have a couple of years ago. So I joined the party a little bit late in that sense. So there's this window of opportunity from the age of 25 to the age of 40, right? You start moderately at the age of 25. Hopefully you've been training from the age of 15 and you've been doing the healthy diet and the hard training and the daily cardio and the health supplementation, and you've really maxed out your natty gains. Then when you're 25, you got a decade of experience with bodybuilding already, which is a lot of experience, and a similar experience to what somebody needs when they go through medical school. Then when you're ready to take this leap, your body is so ready. It's so ready for this stupid baby cycle that everybody will tell you you're crazy for running. 250 milligrams a test, you're crazy. But you will blow up. You will blow past all these fuckers that have been cycling for years because you put everything into place to really maximize your natural potential, and you're so in tune with your body regarding training and nutrition and supplementation and cardio, etc., that a little baby dose of 250 milligrams test, and perhaps a clinical dose of 1 ampule of Beta-Rimobolan on top, right, per week, is going to make you blow past all of these clowns. You're going to blow past all of them. You're going to get great results. And then you don't need to do these stupid experiments that I did of a gram of tren or a gram of nandrolone only, or a combination of multitude different compounds, albeit at way too high dosages. You just start with the lowest effective dose and build your way up over the course of 15 years. And by the time you're 40, you have developed a very impressive physique on dosages people would laugh about and call you a liar for. But at least your blood work will look good. At least your blood work will look good, man. And you don't have to be an obsessive hypochondriac during this period, because you've never really pushed the boundaries. You just took a patient approach. By the time you're 40, you should have built a substantial foundation of muscularity, right? Restricting yourself to this weight class of classic physique plus 10%, right, for your height. And then as you're entering this later state of life, after 40 years and upwards, you can just maintain everything that you've built on a fraction of the dose. A fraction of the dose with your health intact. With your health intact, guys. That's key. So you don't have to sacrifice your health during this 15 years of a window of opportunity that you can subject yourself to drugs, because you're going through this so slowly. You're restricting yourself to this weight category of classic physique plus 10%, and then you leave it there. You leave it there. It's far more marketable. You can make way more money having a physique of classic physique, because it doesn't take so much money to maintain, and it certainly will not deteriorate to abysmal levels to the point where bodybuilders get themselves up to right here, like off the screen, phenomenally big, and then their body deteriorates and falls apart, and they're a complete shadow of their former self because they can't even run TRT anymore because they got so unhealthy. And I see that happen so much. And it's not with the bodybuilders that you know. It's these amateurs, right, that really push the boundaries and did not do the blood work and the imaging and just put the head in the sand and, well, wanted to grind, never really got there, and then have nothing to show for it besides a couple of Polaroid pictures. Right? The whole goal of this is to enjoy bodybuilding until a point when you're ready to quit by yourself, because you want to have kids and spend time with them, and realize that you could be playing with Lego and video games instead of spending 2 hours at the gym. Right? That would be my choice. If I have kids, why would I go to the gym when I can spend time with my kids, dude? If there's only so many hours in a day. You know, it would be great if YouTube survives like for the next couple of decades, and one of you watch this video at the age of 19, 20, you follow this to the T, and then 30 years from now or 20 years from now when you turn 40, and you've done everything that I just mentioned in this video, step by step, right? You stick with pharmaceutical grade, and you avoid all the carrier oils that are highly inflammatory, and you stuck with clinical dosages, and you were patient, and you didn't get your body weight up too high to the point you started compromising your health or got sleep apnea, and you're 40, and then you maintain your phenomenal and healthy physique on a fraction of the dose, being TRT plus, right? 150 tests, 125 milligrams of Primo, a little bit more than supraphysiological levels. But I think you would have earned it. And I think your blood work would validate that kind of approach as it did validate that kind of approach for me. That would be freaking awesome. I'll be 60 years old by that time. But I would like to see that comment if YouTube survives that long. Couple other takeaways. Get a partner that is able to reel you back. Because again, I know that it's very addictive. It's very addictive to be big. It's very addictive to undergo the transformation, go from a sloppy, skinny fat to right freakishly looking classic physique guy, for example, or bodybuilder, if that's still within your aspiration window. I know it's highly addicting to experiment with compounds. I suffer from this addiction myself. If you have a supportive partner that knows how to reel you back and validates that you're good enough, even if you have to slim down a little bit, it will prevent you from making a lot of bad mistakes. I'm going to leave it here for now because this video is already way too long and I still have to edit it down to 30 minutes or less. That seems to be the sweet spot for YouTube videos, but there's a lot more to be said, a lot more guidelines I can share with you guys so you can have good results, albeit maybe not phenomenal results, at least good results so you're happy with your progress in the immediate short term and happy with your choices in life in the long term. Because, well, I've been doing a lot of consultations with older guys that are 50, 60, 70 years old, and they got themselves into a health condition at maybe 10, 20 years prior due to poor performance-enhancing drug practices in their younger years. And they regret it, man. I regret making a lot of decisions when I was right up until 30 years old, 32 years old, when I started dabbling with the higher dosages. I regret that shit. I really do, man. I really do. And I wish I could prevent some of you guys from making the same mistakes. As many of the guys that I did consultations with wished I had somebody like me and like Leo Longevity and Derek from More Plates, More Dates, teaching safer practices over and over and over again. Again, we didn't have these opportunities and this information source at our disposal when we got started with PEDs, but nowadays we do. That's why I'm trying to give back to you guys so you can make better choices and have a long and fulfilling life when you're done with this shit. Leave it at that. Thank you guys so much for watching. If you're looking for the most comprehensive guides for safer practices regarding the use of performance-enhancing drugs, vigoroussteve.com/shop. They're limited to bioidentical hormones for a reason. These are hormones that you produce by yourself, and using them at superphysiological dosages with the things that I discuss in these ebooks at least makes the journey towards a phenomenal physique a little bit more safe. If you're looking for personalized advice, I'm always available for consultations. You can find the rates in the consultations section. Follow me on Instagram and TikTok at VigorousSteve. Front double bicep for the health-conscious Vigorous crew, growing every day. More and more people are joining the Vigorous crew, and well, I would like to get up to 50,000 subscribers before Christmas. That would be a very nice Christmas present. We have a couple of weeks left, so feel free to do your part. Share this channel with your friends, your gym bros, your grandma. Right? It's never too late to get into fitness. And it's not like I'm only talking about performance-enhancing drugs on this channel. Vigorous crew, make it so. I want to see 50,000 subs by Christmas. That will be a very nice Christmas present for me. And then in 2022, I would like to see 100,000 subs. That would be fucking sweet. Thank you guys so much for watching, and I'll see you in the next video.